The situation in Nigeria has devolved from a mere semblance of Orwellian inequality, where some animals are more equal than others, into a more disheartening reality. A corrupt system where a greedy few, akin to a tyrannical elder brother, perpetually subjugate others to maintain their own dominance. Recent revelations disclose that legislators earn approximately 29 million naira monthly, excluding substantial kickbacks, which could amount to billions. Furthermore, the minimal educational requirement for legislators is merely a secondary school certificate, without the necessity of passing SSCE. In stark contrast, medical doctors spend 6 to 7 years in university, and nurses invest 3 years in nursing school or 5 years in university. Despite their extensive training, registered nurses often receive as little as 40,000 naira per month, while some doctors earn as little as 100,000 naira. Legislators, who have pledged to prevent medical practitioners from emigrating, have yet to ensure fair remuneration and welfare for these professionals. Meanwhile, European countries offer enticing opportunities for our medical personnel, with registered nurses earning upwards of 5,440,000 naira monthly and experienced practitioners sometimes exceeding 17 million naira. The frustration grows as these legislators' disproportionate earnings starkly contrast with the abysmal governance that has plagued Nigeria for decades. Health workers are rightfully seeking better pay and opportunities abroad, especially when faced with daunting challenges at home: severe infrastructural deficits, drug shortages, manpower shortages, inadequate government funding, and hazardous working conditions. Despite the NHIS's establishment over a decade ago, it has only covered a negligible 5% of Nigerians due to rampant corruption and inadequate funding. The recent decision by the Nursing and Midwifery Council of Nigeria (NMC) to impose nearly impossible conditions for nurse verification further compounds the issue, betraying its members in the process. The NMC's actions have left a bitter legacy among Nigerian nurses. The Nigerian healthcare system's dire state stands in stark contrast to the well-developed systems in Europe, where healthcare workers enjoy excellent working conditions and substantial pay. The former colonial masters now offers better prospects, while Nigerian leaders' cold and frustrating approach has left parents disillusioned, as their children, who have invested heavily in nursing education, still rely on them due to inadequate local opportunities. It is profoundly unjust for the government and NMC to obstruct nurses from seeking opportunities abroad. They should not be penalized for the failures of Nigerian politicians who have depleted the country's resources and left its citizens impoverished. These nurses are merely striving to improve their own circumstances, as every Nigerian seeks to escape the prevailing hardships and the looming uncertainties of Nigeria's future. Doctors and nurses deserve the freedom to pursue better opportunities for themselves.